But shame and disgrace, some of them so green, mean under 16, like some crazy ants, causing disturbance. These juveniles really growing wild, yeah. No use talking cause they ain't care. Talking only falling on them there. They jump from Harry and they jump to Gary. They jump from Gary and they jump to Stevie. They jump from Sammy and they jump to Tommy. They jump from Tommy and they jump to Stevie. Monkeys the cool breeze. Wait till fire upon them.
99.9 WEFM. WhatsApp us or call us at 457-9997. Activated Mornings on WEFM 99.9 is on now.
Alrighty, so time here in SPG, it is 7:46, and we are, let's not tell all you, bear with me, it's a Monday morning, all right? It is 7:46, and we are already joined on the line by Mr. Kingsley DeFreitas. Kingsley, good morning to you.
Yeah, good morning to you. When you were younger and you were listening to NBC Radio 75, what was your favorite program you pay attention to?
Listen, it used to be Christmas time. Rhyme a line, and all those things. It was Christmas time for me. And then I remember Unshackled and yeah.
When I was young and I go to the countryside, right? It had a radio announcer used to work at WEFM called DJ Monty. He used to do the reggae blast. And when he do a day shift, we used to put him to do the obituaries that we call death announcement, because he has that voice that sync with bereavement, and more people listen to NBC today for death announcement, right? And I don't know if you remember, before COVID-19, approximately 900 people used to dead a year, right? And then we had 2 main funeral homes. I don't know if you advertise it, Everready and New. But after COVID, a lot of people died, and you still not getting any information if some of the people who died were related to the issue of the infection and COVID-19. And you will hear some people say that vaccines are responsible. Dr. Thompson appears on this religion all the time with a program every Wednesday night. Your Health Matters. He comes here every Monday, and you will never hear Dr. Thompson come and deal with the issue that surfaced with COVID-19 and the negative impact, where we had people who suffer casualty from their belief that something is wrong and COVID-19 created some problems. But I am a living example of experience where I think that the COVID-19 vaccine had a negative impact on me. I know of another taxi driver, I'm not going to call his name, but he don't work anymore because he didn't take the vaccine. So, but they call him back, so I don't know if he's coming back. And it's a people who would say, you hear these kind of remarks, boy, people there like flying children, so I'm never call them that. And you wouldn't hear no person who was the professional Dr. Thompson make any comments. They don't want to offend the authority. We hear where the authority went and made a bill to Parliament to make frontline workers like myself who did take the vaccine, and I am convinced that it had a negative impact on me because I went to the hospital on several occasions, and I went to a private doctor, and they still being careful not to say is the vaccine that creating a negative impact. So I just want people to sit down, remember how much people should die, why we should pay attention to that announcement on NBC Radio and now on WEFM is because we want to hear who died, and we come to a conclusion. But I came to a conclusion since 2021 that the most of the death that is taken serious and again is appears to be related to COVID-19 and its negative impact via the vaccine. And you don't hear anything. You hear all the professionals speak. You hear all the, like, doctor. I have to stress on Dr. Thompson because he's a politician and a doctor and an apologist for the ULP. And it's frightening because, like I say, Ms. Samuel, I have not been the same person. I have lost the drive for doing everything. Even to go to work sometimes, I think, well, I want to sleep a little later, but when I remember, boy, you have to pay the bill, you have to get up and go. So you have people out there who are suffering silently because of the negative impact on COVID-19 and its vaccine. And let me tell you something. I believe that when the teachers took the matter to court and the Honorable Justice Esco Henry made her final decision, I think that she was within the right. But the appeal judges think that she made an error, and now we are waiting on the outcome of the Privy Council and their findings. So right now, the appeal court says to say this again is what was suggested by Ralph Gonsalves. It is law until we hear from the appeal court. But I believe that I am making an appeal for persons who have similar perception that they concern the vaccine. Send Dr. Gonsalves and Jimmy Prince a message and let them know that we were hurt and we're still hurting, and don't vote for the ULP or the Minister of Health when it comes to the issue surrounding the vaccine. And that's my rant for today. I'll have a wonderful day. See you tomorrow.
All right. Thank you very much, Kingsley. Have a good and a safe one today.
Yeah.
All right. All righty. So that was Kingsley's commentary for today. And he spoke on, did the COVID-19 vaccine have a negative impact on some person's health? And for him, it's not a question, it's his actual statement. All right. But of course, we had to put in a question format on the live. So yes, Dianna, any thoughts on it?
Boy, I've heard that same thing of many persons saying that it has had an effect on them. I heard or saw something not so long ago talking about the amount of persons that died and if some of them are COVID related or COVID vaccine related and so on. Do I expect to get any sort of, how should I put it? The kind of information that Kingsley is saying that he's not hearing from the officials. I don't expect to hear any of those from the officials. I mean, I don't expect anybody in the medical field or related in any other related field to come and say, well, you know, there was actually an issue. I don't expect that to happen when pigs fly, right? So to be honest, for me, if I took the vaccine, I can't tell you whether or not I've had some negative effects because I feel like I was having some sort of issues even before the vaccine. And I'm not the type of person who was going to the doctor and checking. If something hurt me, I just ignore it and hope that
it goes away.
I just think happy thoughts.
Oh, wow. That's your medicine? Thinking happy thoughts is your medicine?
Sometimes. You know, if I feel a pain, I think, oh, you know what, it's just a pain, it'll go away, you know. So that was what I was using before. So I can't honestly say if I've had negative effects. I have friends who have said that the vaccine impacted their periods in a significant way to the point where now when they have their periods, they have to be wearing Pampers. Versus, know, before I had one friend who, she said she bled for an entire month after taking the vaccine. So there are persons that have, you know, spoken about the negative effects on them. But at this point, I don't know what to do. It happened. We're going forward. I will always say that I never agreed with that vaccine mandate. I could never ever forget because I saw how it impacted the people around me, people that I looked up to. I saw how they cried, how it hurt them so much to have to go through that after sacrificing so much for the nation. So I have forgiven the people, you know. I don't feel as hateful towards them as I did in the beginning, but I'm not gonna forget. I've forgiven, but I ain't forget.
Okay.
Yeah.
So to ask your business, did you want to actually take the vaccine?
But I wanted a job because I don't like the begging life. and being at the mercy. Well, I mean, I am at the mercy of others. I depend on an employer, but it's just me. I'm my only breadwinner. I don't have any nanny, godfather, boyfriend, girlfriend, sister, brother. You know, it's all me. So I didn't see any other choice unless, you know.
Okay, so you were one of those who were forced to take it.
Yeah, you know, they don't want to hear that you were forced. You know, they'll be adamant that you had a choice. It's either you take it or you don't take it. Sounds like a choice to me, but
no, it's either you take it or you don't have a job. So that's not really a choice. All right. Okay.
Yup.
All right. So yes, I also was not in agreement with the mandate itself. Although I did choose to take it, right? I volunteered to take it, but of course, my employer, we didn't even have a conversation with this regarding my employer, but I was working in private sector. So I don't even remember one single conversation of my employer having with us regarding whether we should take it or not. It really and truly was left up to us as members of staff, whether we chose to. So in our Vinci office, all of us actually did. We went and took the vaccine together. But I know that in some of the other offices, not everybody, regional and the international offices, there was at least one person in the Barbados office who was. Listen, every minute she's sending me some kind of mess, some kind of things she come across on YouTube with the conspiracy theories. Every minute. Listen, COVID was a horrible time, you know. COVID was a horrible time. Between the whole debate about people who don't want to take it, you know, to those who had the conspiracy theories, to those who opposed to it. Listen, I could not wait for more than one reason for COVID to just go away, all right? Because it also caused a strain on the type of conversations that you had with persons. I mean, even there was one time, I'm not going off on a tangent, again, back to the topic just now. Even there was one time, so, you know, persons were working from home and everything. So I was going to the office a morning. Now, where it is that I have to walk to go to the office, hardly anybody was on the road. And a guy was driving off in his vehicle, and I did not have on my mask. And this guy is an older gentleman, and he's like, slow down the vehicle. Why it is you don't have on your mask? You don't realize what it is, the impact that you can have on other people. And I am there like, Lord, mister, I just want to go to work, you know, because I knew that I was not going to be encountering anybody on the road. So there was absolutely no reason for me to put on a mask. But I tell you, just walking to work, you don't start to feel the abuse from people.
I'm telling you, boy, you walk around without a mask and you just feel like you just stick out like a sore thumb, boy. Yeah, sometimes
wearing the mask, I can't breathe properly because I can't breathe properly with something over my face. Listen,
normal coughing no longer existed. Every cough was associated with COVID.
And you know how much times you have to cough, and if you do two coughs, it's one cough too much. You know, people turn around, they're watching you and discarding you. I just, it's not a period of life that I want to go back to. But to get back to what Kingsley brought up, I really and truly would like for a survey to be conducted where you ask persons, did they find that anything changed for them after having taken the vaccine, right? Really and true. And it doesn't even have to be government, don't have to get involved in this, right? It could be somebody in the private sector just trying to get the stats together. Because again, for me, what it was with this particular vaccine was that because it was new to market, I can understand, number one, person's hesitancy with not taking it, right? And number two, you're not sure of it. It's not like the polio vaccine that had been around forever. All right, we could take the call. So you were sure about it. Hi, caller. Good morning. Hello.
Good morning.
Good morning.
Yes, it's good to be back after 30 days.
Hey, all right.
Welcome back.
I'm trying to figure out. It's any voice sound familiar, but Good morning, Joshua.
I know. Now I took all 5 doses, and if I come out, take them with no problem. Yes, and I've had no side effects at all. So to me, it all boils down to a matter of personal choice. Would you permit me to revisit Peter's comments?
Sure, go ahead.
Okay, and it might take a little longer than 3 minutes, but I think it's beneficial to all.
Oh, now, you could concise it because we are almost approaching 8 o'clock. So just if you could shorten it to less than the 3 minutes, please.
Well, when you're ready, cut me off, okay? There's a saying, a fish rots from the head. And I discussed during my time in cyber rehab, I discussed this incident with a lot of my social media friends. And there's no excuse at all for what happened. The principal of that school, first of all, should be held accountable. There's no reason at all for students to be left alone once on the school premises unattended. And you asked me to shorten it, so I'll jump right down to the bottom. When I used to be involved in schools, there was this one particular guy, a white guy. His parents were so prejudiced, the only thing black they liked was the tires on the car. And he was harassing a teacher, and the poor teacher couldn't take it. He said to her, I don't have to listen to you. If it wasn't for Rosa Parks, what ends with ASS would be right in the back of the bus. After school, he followed her out to the parking lot, stood in front of her car and refused to move. And he said, I'm moving. So I simply looked at the teacher and said, let me sit behind the driver's wheel. I started the car, I put the car in gear, and I put my foot on the accelerator. And he jumped out of the way. He shouted at me, "Are you stupid? Jump up, get on the banana boat and go back where you come from." But I stepped in as a parent, a concerned parent. So a fish rots from the head. I emphasize the Ministry of Education should read the right acts to all principals. And the principals should then read to the teachers. Why was there not a gym room monitor or lunchroom monitor in that room? I looked at the video and not one person intervened. I felt so sorry for that young girl. If that girl was my daughter, that guy would be having a visit with a baseball bat. Have a great day.
All right. Thanks, Joshua. All right. No, that last part that Joshua said, a visit with a baseball bat, you can't condone violence. You can't deal with violence sometimes, right? And remember, this is a child as well. Well, I'm assuming the boy is under the age of 18, so he was also a child and a student. So, yeah, I wouldn't want to see physical violence inflicted upon him because we know that there's something else up with him. All right, there has to have been.
Just to read a few comments as it relates to the vaccine matter. Well, somebody had commented when Kingsley mentioned the difference. Somebody said it's called getting old when you don't feel like going to work. This person said they took 4 shots. They didn't feel any difference. Another person said I didn't take the vaccine. I prefer to stay at home. But for me, I work with myself. So you're with the good. You're working with yourself. Okay. All right, so somebody was just saying, sorting things on your feeling in the morning, you can blame the cold, me being lazy, and just lack of get up or go for bad days.
All right, so you said it wasn't the vaccine?
No.
If it wasn't the vaccine, then we would find someone else to blame. Okay.
Something else to blame, man. I think that's it.
All right, so just to wrap up that point that I was making, yes, I would like for somebody to just carry out a survey for persons who did take the vaccine to find out if there's anything. Let's just do it from a national standpoint, because international, we know that there are some articles that I've come across that said that, yes, the COVID-19 vaccine did impact the physical health of some individuals, but maybe from a local standpoint, just so we got a little bit more authority on whether or not maybe it affected, let's say, over 50% of the population or only like 30% of the population, right? So we could have some decent enough stats to work with. So rather than it just being the speculation or you're thinking that the vaccine led to whatever it is that you are going through, when it could have been you was going to go through it anyways without taking the vaccine, right?
Well, the thing about medicine is most times, if not all the times, there is always a side effect. I mean, when you're taking your medication, it's something there says side effect, loss of limb, loss of eye, and even death.
And by the time, that's my whole thing. By the time they finish with some of these ads to tell you what the side effects are, is like, let me just go to God. Just God take me. Or let me just not even bother with
plants. Yep, the plants that He gave us. Correct.
All right, so we are going to head on out of this segment at this time.